one. There you go. Good afternoon, everyone. We're going to go ahead and get started with our Panhandle Health District FY 2027 budget hearing. Today's date is Wednesday, May 20th, 2026. The time is 2:03 p.m. And I'm going to call this meeting to order, and we'll begin with the Pledge of Allegiance. So if I could get everyone to stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, and we will do a roll call by county. Is Boundary here?
Yes.
Is Bonner here?
Yes.
Kootenai is here. Shoshone, are you here? Shoshone? Okay. And Benawat? Is Benawat here?
We're here.
Okay. All right. I just heard. So Benawat's here. Okay.
Yes.
Next up is public comment. Does anyone wish to speak? Do we have a place where they can speak? Just state your name and you get 3 minutes. Okay.
So I've been to various meetings at different times. I just want to make a suggestion at the beginning that I would appreciate it. I do appreciate it that you're having an openness for public comment at the beginning, but I think it's much more rational that you would have public comment at least also at the end of the meeting so that people can hear what's going on and then they can maybe respond in also.
Thank you. Duly noted. Anyone else would like to speak? Okay, hearing nothing. We're going to go into our welcome remarks, and we will have Dr. Thomas Fletcher, the Panhandle Health District Board Chair. Dr. Fletcher.
Thank you, Commissioner, and welcome all of you. For us, this is a pretty big deal. I mean, it's how we run the rest of the year. For you, I guess it's just another day of business, but this is as it should be. The state legislature, when they set this mechanism up, intended for there to be a mechanism of checks and balances. So I see this exercise today as that exercise. So welcome, and we are at your disposal.
All right. Well, thank you, Dr. Fletcher. Next up is the FY 2027 proposed budget presentation, and we have our Panhandle Health District Director, Eric Kettner.
Thank you. And again, Commissioners, I appreciate your attendance and you taking the time for this meeting today. In front of you, you have packets related to the budget presentation that was given in recent weeks to each of the respective commissions. That budget has not changed. This is that same information. I'm not going to go into the same level of detail that I did in the meetings, but this information is in front of you. The budget for the Panhandle Health District, the proposed budget for Panhandle Health District for fiscal year 27 is $12,299,702. The ask of the counties is $2,216,903. That is the same reduced ask as last year. We have a fairly steady reduction in our ask of the counties to contribute, and this is a continued demonstration of that. So with that, I'm certainly open to any questions that any of the commissioners may have.
Thank you, Director. Are there any questions?
No.
Any questions online? Okay, hearing nothing. Would anyone like a presentation? I just want to ask while we're here. on the budget? Anybody online would like a presentation? I hope they're hearing us.
Yes, and I'm keeping an eye on the chat as well, and nothing has come in yet.
Okay. Well, with that said, then we'll move into the FY 2027 budget proposal. It's an action item. Is there anyone who would like to make a motion on this? No one wants to make a motion on the budget?
Commissioner Domke is typing.
Okay.
Said audio is working well on his end. That might have been just a comment for me. Sorry.
Are we sure that they can hear us? I don't want us to run through this meeting if they are not able to hear and be responsive.
Commissioners online, can you please let me know in the chat if you can hear us? Yes.
Okay, so we're on an action item. I'd like to take a motion.
I'll make a motion for a roll call vote.
Okay, and that is to approve the budget.
Approve or not approve.
Well, you have to make a motion for one of those things, and then we can.
I make a motion that we do not approve the proposed budget.
You make a motion that we do not approve the proposed budget. Is there a second?
Commissioner Domke seconds.
Okay, discussion. Commissioner Bertling, you do not want to approve it. You want to talk a little bit about why?
I don't want to approve it for the fact that for our county, it does not benefit with bringing clinicals back to the point where it makes sense to do that. We are set up well for that. And I would like us to go back to doing what PhD does well and really get get environmental and keep our WIC programs and CERT programs going.
So you want the clinical services to be there?
No.
You do not want the clinical
Yes.
services
I
to
want
be
a budget without the clinicals there.
without the clinical services. Is there any other discussion on that?
So Commissioner Domke will offer that, first and foremost, I'd like to thank the Health District Board and the staff for the way in which they prepared and presented the budget this year. I found it to be very thorough and clear. And so I also appreciate the input that they requested during that process. However, from my perspective, and that of our board, one of the biggest challenges, and I realize this is based on how the legislature has set up the statute and not a choice of the health district, but because of the statute, the requirement to have a budget in place by the first Monday in June is so far ahead of the county's budget process that the proposal to provide a cost of living adjustment with regard to compensation within the budget, for me to vote in favor of this budget would mean I would have to make a decision to support a COLA for staff of the PhD before knowing if our county has the ability to provide any such compensation increases for our own county staff. And so unfortunately, that creates a fiscal condition that is out of sequence from a county budget perspective and an equity perspective within our own county. And so for that reason, which was a unanimous perspective of our board, I cannot support the budget as presented.
Commissioner Domke, I understand your point. It's duly noted. How would one get around that with respect to addressing a COLA for Panhandle Health staff and a budget that has to be presented before your budget is finalized, your county budget?
I don't have a great solution for this year, given the statute, the way it's written, unless that becomes amended for future years. So I appreciate the conundrum. The The issue is, however, that if I were to vote to approve a COLA for the PhD staff, and then we are ultimately unable to match or do something similar for our own county staff, then I would be creating an inequity. And so it's a challenging situation, and I don't have a great solution, but I'm unwilling to create that potential inequity.
Are there any other comments or discussion from the other commissioners? Commissioner Zimmerman, Commissioner Short,
Zimmerman is typing. Commissioner Zimmerman has a question regarding doubling the clinical and the problems we are facing are environmental. I have a question regarding doubling the clinical and the problem we are facing are environmental.
could he elaborate on that a little bit? I'm not quite sure I'm understanding that comment or question. Is he not able to speak in and so we could hear him?
His mic is not working.
Is there
Yes,
any way-
there's a phone number, Commissioner Zimmerman, on the agenda that you can call in.
Provide him that number.
Yeah. It is, I'll just type it out.
Is this a conference number where the other commissioners could call in as well?
Yes.
I think that would be more productive for a meeting like this. It wants a conference ID.
say whatever we can get to work to get them engaged. Is Commissioner Short having difficulty with his microphone as well?
Commissioner Zimmerman, it's not showing up on the meeting. Can you just call the 208 number that I put in the chat? And then Commissioner Short, are you able to use your mic? Speaker. Oh, speaker. There you go. That's Commissioner Zimmerman.
Yep, I'm here. Okay, Mr. Chairman, did you want me to speak?
Yes, Commissioner Zimmerman, go ahead and speak, please, and ask your question or provide your comment related to that.
Okay, my question is I've been told that they wanted to double the clinicals. And up here, we haven't even got data on the clinicals that we have now. I mean, we don't know how many people that we serve for the year. And the biggest problem we're having right now up here is we're having sewer problems. We're having more environmental problems. We've got all these campers coming up here, and there's problems of people dumping their sewage in campgrounds and other areas or on property. And so my board feels that we need more environmental than we do clinical at this point.
Okay. Well, I tell you what, we're gonna continue this conversation, but we have a motion to deny and we have a second on that.
Okay.
I'm gonna go ahead and take a roll call on that.
Okay.
This is to deny the budget, the FY27 budget. We will begin with Boundary.
Yes.
Bonner.
Yes.
Kootenai is no. Shoshone
Yes.
and Benawa. Benawa, can you hear us?
Commissioner,
Can you hear me now?
We can hear you now. What is your vote on denying or turning down the FY27 budget?
Deny.
So that would be a no.
Correct.
Well, yes to turn the budget down, or no to you're against turning the budget down.
Yes.
Yes. Okay. All right. So the motion carries. So at this point, I guess the question is, to Panhandle Health, have any of these concerns been brought to your attention throughout the budget process?
There have been concerns by the board on some aspects of the details of the plan to stand up the extensive clinic.
Mhm.
I believe that Board Member Nolan brought those up as well as others.
That is to close the clinics or to,
I think it has to do with the detail in moving the clinic forward.
moving the clinics forward.
The detail of the plan, of any plans to move.
Okay. Dr. Fletcher.
Commissioner, so it seems to me that there are several topics in play at the same time. let's start with one, the COLA. We have built into the budget a 2% COLA. This is the first our original version had a 3%, actually backed it down to 2%. So hearing now that it shouldn't even be 2% or the timing of the COLA is a new topic from my memory set. The second issue on the table has to do with the adequacy of the environmental services. Again, and I would refer to Jason, who's in the room. Environmental services are always top of the list, particularly for a public health institution. But the idea of throwing more financial resources into that department, this is new to me. I thought that we weren't asking for more money to begin with, and it was my understanding, and I really am going to turn it over to Jason in just a second, that we were functioning as expected. So that we are functioning subpar is new to my thoughts. May I allow Jason to, because he's head of the environmental services and would have a pulse on this topic.
Yeah, so is this?
Yep.
Hear me okay? Okay.
It should be on. Just have the microphone closer to your mouth.
Yeah, so in regards to Commissioner Zimmerman's question, there are frequently complaints of or instances of discharge of RV waste in really every county that represents the 5 northern counties of Idaho within our jurisdiction. We work through those complaints, work towards compliance, either getting septic systems in, central wastewater disposal system, working with property owners for other options. So in that context to that specific example, just really recommend that we, receive complaints so that we can process those properly. But other than that, we're staffed appropriately in all of the 5 counties, including Shoshone County, and the budget was crafted to be budget neutral in the septic program. But again, if there are additional instances of those types of situations, we really just need to be made aware of them so that we can properly work through those and work with property owners to correct them. We recently, for example, went through that with the Benoit County Commissioner. Similar complaints up along the St. Joe River in Benoit County have been working on that since that time. So that's just normal part of the environmental health services that we offer, and this budget is not drafted to have any decreases in environmental health services for any of the counties, including Shoshone.
Chairman, if I can make a comment, in some of my conversations with commissioners in Shoshone County, we have an extended role because it is the Bunker Hill Superfund site. I also know that the county has had challenges bringing on code compliance officers and planning and zoning directors. So if we're having a discussion about needs for our respective counties, I think that it's fair to say that certainly at this time, Shoshone County is looking for some additional services from the health district to help them with the issues that county is dealing with.
Yeah, and if I could have you just walk through, I think this year, while the aggregate contribution is the same from the previous year.
That is correct.
It's actually, could you walk through each of the 5 counties and their contribution between last year and this, or FY26 and the proposed FY27? Because I believe it drops for all the other counties except for Kootenai County. Is that correct?
I believe that's correct. Yes.
Could you just read that into the record, please?
Yes. Change in county support. If you're following along, this is page 8 of the presentation. Benoit County is seeing a reduction in ask from fiscal year 26 to 27 of $1,659. Bonner County is seeing a reduction in $2,106. Bound is seeing a reduction in $1,287. Kootenai is seeing an increase of $6,216, and Shoshone is seeing a reduction of $1,164.
So in essence, for all the other counties, the dollar amount that's being asked is less than FY26. Is that correct?
Mr. Chairman, may I make a point clarification?
Yeah, and who's speaking?
This is Jeff Zimmerman.
Oh, yes, go ahead, Commissioner Zimmerman.
Okay, it was my understanding that they are actually inserting about over $400,000 in cash for this budget season. They're taking reserve money and they're going to use it for this budget of about an amount of $400,000. And that was one of the concerns is okay, if they're going to double if we're going to double our clinicals, how does that work? I mean, I think you're up 1 day a week. Are you going to come up 2 days a week? Or, we haven't got past if you're going to double the clinicals, what does it look like for us?
Director Kettner?
Commissioner Zimmerman is correct that there would be the use of an additional $400,000 and I believe $18,000 from the health district's reserves to stand up the proposed clinic.
But that's not for operations, that's for infrastructure, correct?
That would is the amount from reserves needed to augment personnel operating the.
Okay, so Commissioner Zimmerman, is your concern the fact that it's standing up infrastructure which will, in FY28 prospectively, increase the ask from Panhandle Health to each of the counties?
Yeah, that's part of it because, if we burn through cash this year, we're going to have to burn through cash next year unless we get more revenue somewhere else. We're borrowing. And really at a point in time that we are in with our, the same as what we're in Shoshone County where our revenue is low. I mean, I don't know if that's a good idea. And the other thing is like I've said, is we haven't got any data on how many people they serve up here. I mean, we don't know what our clinic is even doing. I've never been shown any data that how many people we've served in the county and what they've done or anything. So that's one of the problems that my fellow commissioners and I both have is, where are they spending? What are they serving? And who are they serving?
Okay, so there's two questions there. The first one is, what is the likelihood, and this is for Panhandle Health, Director Kettner, what is the likelihood that if you stand up these additional clinical services, that you will come to the counties the following year and ask for more money to cover the operation of these services? Do you expect to come for more money? Do you expect it to remain budget neutral? How do you see that?
This proposal, as far as the clinical expansion, is largely being driven by the medical subcommittee and the chair and also Dr. Pennock. So I would defer the question to them on.
Okay, but we haven't done any kind of fiscal analysis as to how that would affect the future years. Is there an answer to that as far as how that would affect the ask for the future county or the future budgets to the counties? Oh, it's to your, there you go. Just make sure it's green. There you go.
Let me try to address that, Commissioner Matari.
And just state your name for the record, please.
Greg Pennock, I'm the medical director.
Okay.
Panhandle Health. So clinical services is actually one of the departments that can actually generate its own revenue. And we do this through medical services. So in our view of what the clinical budget looks like, we're hiring nurse practitioners, physician, clinical people to generate revenue. And we anticipate that they will do that at about a 3x rate of their salary. So in the private sector, in the real world, we look at clinical people as revenue generators, not as expenses. We expect the same thing would happen in public health. So I think that answers the first question.
Commissioner Zimmerman, does that satisfy you as far as that answer?
I didn't hear the end of it because you kind of speak a little louder?
Basically they seek to have a 3x multiple on the expense of clinical services. So if it costs $100, they're seeking to recover $300 for providing those services.
Okay.
And so they do not expect it to require
Expected to raise.
additional monies from the counties by expanding such services.
That's correct. There admittedly will be a startup period. We're hopeful that we can ramp these services up quickly. We've got the space, everything's in place already. What we need are the people, the bodies.
Did you hear that, Commissioner Zimmerman?
Yeah. Yeah, I heard that.
Okay. So that's the answer to the first question. The second question, of course, is getting information or data on who is being served in Shoshone County among the other counties. And Director Kettner, could you answer that? Is data being provided to the counties as far as who is being served?
Again, I think I would defer to Dr. Pennock's analysis.
Okay.
So one of the things that I did when I came in was to look at the proportion of patients that were being served in each county. And what I can tell you is very close to the proportion of population in each county, or by definition, the amount of funds, revenue that they contribute to Panhandle Health. As far as the exact number for Shoshone County, I can't give you that, but I can say it's very much in proportion with Kootenai County, with Bonner County, Boundary County. Shoshone County now has one clinic a month there, and we fully anticipate 2 clinics there a month, so to double the services.
Well, perhaps, and it's probably not unreasonable to provide some sort of reporting by county, at least for the commissioners, because I think it is an important service and we should at least be able to show.
Oh, I fully agree, and that's a reasonable request. We were not asked that during the presentations at the counties, but I think it's a very reasonable request.
Okay. Commissioner Zimmerman, is that answer suitable at this point in time?
Yes, it does.
Okay. So if just real quick, if we could establish that these expansion of clinical services will not lead to asking the counties for more money, and that Panhandle Health District will start providing reports, whether quarterly, semi-annually, or annually, on the constituents that are being served by county. Is that something that would be satisfactory to you with respect to this budget?
I would believe so, yes. Yeah,
Okay.
that would be. So, that's the questions we're kind of getting from everybody else is we're paying into it, what are we getting out of it? And that's the type of questions I'm getting from my other board members as well. So it would be nice to see exactly, what, where our money's going.
Okay, fair enough. Dr. Fletcher, did you have a comment you wanted to add?
Yes, Commissioner. I just wanted to enforce what Dr. Pennock had said. We had already internally set for ourselves the objective of quarterly assessments of the performance of the clinics. I mean, it was not escaped on us that we had an obligation to know what we're doing and how we're doing. And of course, we will share that information with you.
Okay. Commissioner Bertling, were any of the answers that you heard today satisfactory for you with respect to clinical services?
No.
So at this point, you do not want to see clinical services as part of a service offering for Panhandle Health?
For our county, it doesn't make sense to bring that back. It will actually hurt our hospital more than it will benefit it, because they already have their clinicals going across the street.
Mm-hmm.
They're already in not great financial shape with 13 days cash on hand. We would like to see that a lot more, at least in the 30s or 40s.
For your hospital?
Yes. And so this program, bringing it back would not, yeah. And I think I frankly think to try to pull patients from Connexu up there and from these other areas that do use us, like, I think that's pie in the sky. I think that and how I think we would be looking at tapping into our reserves again next year.
Okay.
I don't see how,
Tapping into your reserves
no,
for,
in Panhandle, PhD would have to tap into the reserves to keep it going again.
you mean to come to the counties and ask
No,
for more money?
Well, they'd probably do that. I hate to, I don't like tapping into the reserves at all.
Uh-huh.
The state basically gave a refund, and now we're in the hole. And now our infrastructure's suffering on our roads. So I think you need to have something in case something catastrophic happens. You need to have that reserve.
If there were a way to eliminate the expansion of clinical services in your county, would that be satisfactory to you? Because your county obviously isn't being, it's 5 counties.
Mhm.
Would that be satisfactory to you with this budget?
Then we're paying in and not getting anything back at all.
Well, it's all
So-
pro rata based upon population. So you're getting more than just the clinical services with your contribution. And so what I'm trying to do is identify a pathway, because what we have right now are conditions. And if we were to follow your suggestion, that would mean reducing clinical services to the other 4 counties in order to satisfy your county. And I don't know if that would be,
I think the other rural counties are probably in the same boat as we are, as far as with everything I've stated.
okay, well,
And really, I'm curious about the fact that we're trying to hash this thing out when there was a vote on the table.
we voted
Yeah.
and we cast the vote, and I'm just trying to understand if there's something, there has to be direction afterwards. I mean, if we close the meeting out with no budget, and this is the first time that Panhandle Health is hearing about some of these issues, this is a good time for us to at least start talking about it. If the budget is turned down, it's turned down.
I personally would like to see a budget without it and see what that would look like.
Okay,
But that's my opinion.
okay. Director Kettner, do you have any thoughts on the clinical services as far as different counties? Or is that a one, it's all or nothing?
I'm not sure how that would financially work. I would certainly defer to the counties on their perspectives.
Okay. Well, it sounds like at this point, what we need is specific feedback for Panhandle Health. And then we're going to have to set up another meeting. Part of the reason for this discussion is because we cannot manage to a budget if we don't know what the objections or conditions are. And so that's part of the reason of asking. It's not meant to put anyone on the spot or anything like that. But so I think at this point, with respect to the clinical services in Shoshone County, that has largely been addressed. Is that a fair assessment, Commissioner Zimmerman?
Yeah, I would. One of the problems that I'm remembering too is that, last year they were looking at doing away with all clinicals. So did they do away with some clinicals up north and not down in our area? Has there been clinicals in every county right now, or some of them don't have them?
I can't, is either of you gentlemen be able to answer that?
Currently, we have clinical services in all 5 counties.
Okay.
We recently restarted Boundary after a period of being without services up there, but we have.
Okay, so
5 out
Boundary
of
was
5.
out. Okay.
Okay.
And what Commissioner Zimmerman may be recalling is the April meeting last year where there was a discussion, a town hall on the value and future of clinical services.
Yeah. Okay. All right. So are you good at this point, Commissioner Zimmerman, with related to this topic?
Yes, I'm fine with it.
Okay. And then the other topic that you brought up had to do with, I believe, health services, with environmental services.
That was one of the other questions we have, and and I know we do have, we are lacking some services on the county level, but I am getting complaints about sewer systems and whether, and I'd have to defer, I'd have to ask, Commissioner Cowles has been really involved in that. So I want to look at, get more data from her on that.
Can you provide that data to Panhandle Health, please?
Yes, I can do that.
At least, the concerns and figure out, at least something where people can figure out a pathway, because we will have to get this budget approved at some point, and not very far off into the future. So, okay. Commissioner Domke, your point about the COLA is duly noted. The amount that Panhandle Health is asking for from Bonner County this year is less than FY26. Is it the concept that Panhandle Health might get a COLA and Bonner County employees may not get a COLA? Or is there a different issue on the table because they're not asking for more money from the county, they're actually asking for less money than FY26?
Yes, understood. It is not the total dollar amount being requested, but the potential, as you were indicating, that if I were to vote in support of the 2% COLA to PhD staff, and our county was not able to provide a similar amount to our staff, then I would ultimately be creating an inequity from our staff to the PhD staff. And that, I wish I've been trying to rack my brain to determine if there would be a way to make it conditional, but I don't see a way within budget approvals to make something like that conditional. But otherwise, yes, I'm concerned about the potential of an inequity because of the sequence of timing that happens between the PhD budget approval and the county budget approval.
Yeah.
And in some, when there's less challenging fiscal years, that hasn't been an issue, but the FY27 year has enough financial concerns with revenue cutbacks from the state and other sources that, we are concerned about whether or not we would be able to treat our staff in a similar manner.
Okay, now what if, I guess, the question that comes to mind is the fact that we're dealing with 5 counties, right? And so your county may or may not have a budget issue with respect to a COLA. The other counties might have the opposite situation. So that would still, so you're just looking at it from that perspective and only that perspective. Is that what I'm hearing?
Correct. That is the one perspective that our board unanimously shares. And so that is the reason that I'm casting a no vote on the proposed budget. And as I said, I understand this is a very challenging condition that I'm bringing forward for my vote. And I've been trying to determine if there was some other aspect to it that could resolve it, but I'm failing to come up with a solution from my perspective for my vote.
And if for some reason there is no COLA with Panhandle Health this year, but you're able to implement a COLA with your staff, what would be done? How would that be managed too on Panhandle Health's budget?
Yes, so if I'm understanding you correctly, Mr. Chairman, that could create an inequity on the other side.
Well,
which would be, undesirable as well. But my top priority is our county.
Mm-hmm.
And so I have to make sure that that's the primary interest that I'm representing.
Okay. All right. Well, it sounds like then the direction is to at least put together a proposal of what no COLA, and then we'll have to reconvene with a budget proposal or 2, or maybe even 3, that we can figure out how to get something passed by the deadline that's set in statute.
Mr. Chairman, can I point out something?
Yes.
I understand the COLA, but the other thing is what's also, seems to be bothersome is we're given a COLA, but yet we're borrowing cash. We're taking cash, we're taking that $418,000 that's on top, we're not fully funded So we're basically given a COLA, but we're borrowing money.
When you say
It
borrowing
may
money,
change next year.
are you
I
referring
mean,
to digging into savings or
yeah,
actual
digging into
debt?
savings, digging into savings when we don't have it. So that's, we can't do that here in our county.
Yeah.
When we haven't had a COLA last year, and most likely, I don't think we're going to have one this year. And the year before, we can't dig into our savings to give our employees COLA. I mean, it doesn't work that way.
Yeah.
But that was just something I just thought of and wanted to kind of bring that question forward.
I think it's a good point. I think in this particular situation, it's, and perhaps someone at Panhandle Health can respond to this, but the idea is that if you're getting 3 times the money back from the cost of the operation, then the idea is that you expand the infrastructure, you provide the service, you generate the revenue, and that money that's in excess of your cost will go back into the savings to replenish it in the future, as opposed to just using it for operations. Is there anyone on Panhandle Health that could either confirm or not on that situation?
Yeah, if I may take a stab at that, Commissioner.
Yes, Dr. Fletcher.
There is a way to make money in medicine. I did it for 42 years. And not to sound flippant, but if you approach a ambulatory clinic as a business enterprise, the mechanisms, the market mechanisms in place are adequate to make a living and even to make money. The group I used to be with, we had 1,000 employees. We paid all of them and we paid ourselves, and it was a profitable enterprise. There is no reason we cannot replicate a, albeit modest, ambulatory clinic business under the auspices of Panhandle Health. In fact, I think it's eminently doable. You can anticipate we will add money. We will be a revenue generator, and you can hold our feet to the fire on that.
Okay, thank you, Dr. Fletcher. Hopefully, Commissioner Zimmerman, that at least clarified that point of contention.
Yes, it does.
Okay. All right, so I think at this point, what we need to do is provide specific guidance to Panhandle Health. One is a budget without the COLA. Another is a budget, I don't know if eliminating clinical services altogether is reasonable, because it would have to go to the other boards. I know our board had no discussion of eliminating clinical services, but perhaps with eliminating it for Boundary County?
Or bring it to the attention of the other board.
Yeah, we can do that. We can do that. And is there any other components to this budget that Panhandle Health should be aware of when it comes time for presenting the next round of the next presentation of the FY27 budget?
This is Benoit County. I'd like to say something.
Yes, go ahead, please.
Okay. Well, as tight as the budgets are for the counties, at least for Benoit, I don't think it's a good idea to be using up the reserves that you have in case things get tighter in the future. And on the clinic side of that, we have a county-supported clinic and hospital here in Benoit County. If we have another clinic there, it's going to cause the county to have to subsidize our clinic more.
Thank you.
And we still have the problem with the sewage in the St. Joe River polluting the water. I know the guy's been working on it, but there's a lot of work left to do on that.
Thank you. For Panhandle Health, is there anything else that you have questions on or need more information as far as for direction and guidance?
No, but to confirm, well, I guess to confirm, we are going to build a budget without a cost of living at 0%. And then we'll build an additional budget for without clinic in.
No, what we're going to do is we're going to bring the idea of clinical services to each of the boards. Correct, Commissioner Bertling? And then each board will decide if they want clinical services in their county. And I trust that if some counties do want it and others don't, then we're just going to carve out for that particular county, and that should be sufficient.
Yeah.
Okay. Okay.
Mr. Chairman,
Yes.
as a point of clarification about one of those budget options, and when you talk about a carve out, would that, if I'm understanding correctly, per statute with the budget allocations per county, I don't think that we could reduce a county's share
Yes.
since it's based on population and valuation. Is that your understanding as well? I want to be sure everyone's on the same page with structurally, if a county wanted to opt out, so to speak, while they may not receive services, I don't believe there would be an opportunity to modify their contribution.
That is correct. What that would do is mitigate the amount of money that's being used from savings, in essence, to be invested into infrastructure for clinical services. So instead of spending, if it's $20,000 per county, if 3 counties backed out, $60,000 would not be used, I presume, for infrastructure, and only 20 and 20 for 2 other counties that wanted the clinical services. Dr. Fletcher.
If I, unwittingly, this would make for a much more efficient clinic. If you think about it, for us to provide a once or twice a month service 100 miles away is an expensive proposition, whereas your patient population is just right here. So, I mean, just from a straight business perspective, is more efficient. So I think we can honor Commissioner Bertling's.
The thing is, later on in the future, when it comes down to then the ask again, I mean, we'd have to then go back and try to do something to restructure this to where our contribution or those counties' contribution would change. Because we're paying into something, that we're not receiving anything for. There's that thought also.
Yeah, I guess as long as the accounting can justify the 3x return on the cost, one could argue that the counties not getting the services would be getting the benefit, because that additional money would be used for Panhandle Health in general, and it could actually reduce the contributions by the counties just as well.
Could. I have doubts.
Yeah. Doctor?
I make just one point that's been a little bit overlooked, and that's the magnitude of clinical services that we're talking about in terms of the total budget. It's less than 25%, actually 23%. So we're not talking about 75% of the budget with clinical services. We're talking about less than a quarter. I just think that point needs to be made.
Okay.
Thank you.
Thank you. I guess, that would be the only other question, is just if without clinical services, would that even change the contribution amount by county? And seeing that difference.
And I believe that would be, I mean, we'd have to talk about the scale of individuals needed to provide the service and figure out. I'm not exactly sure how that would be done, but if that's the direction,
I just want to make sure that when we leave and end this meeting, that Panhandle Health has clear direction from the commissioners, so that we don't have anything else come up, and that we are very clear on this, so we can conduct the business the next time we convene.
I appreciate that.
Is there any other comments, thoughts, direction for Panhandle Health for the next meeting? This is to the other commissioners.
No, not from Shushan.
But is there a way to build two budgets and one without clinicals? And to see what that savings might look like for the counties?
I think you could run
Yeah, we should be able
those
to.
numbers and just see what the difference is.
Mhm.
My hope is that if it's extremely negligible, it's something that we can get past.
Yes. Yes.
You know, if we're talking about 50% of your contribution, that's different than, 3% of your contribution. Bonner County, Commissioner Domke, anything else
No additional comments. Thank you.
for Panhandle Health?
All right.
Okay, and Commissioner Short?
No further comments.
Okay, well, I thank you all. The budget was voted down today. We'll reconvene. You want to pick a date certain on that now, or do you want to get back with us on that?
We'll get back to you on it. One request that I would have is if we're rebuilding these various budgets, what is the best way to share them with the respective counties because setting up 5 additional meetings and then a 6th meeting would be, I don't know if we have the time to put that together.
If I can make a proposal, because I'm going to try to get before our board the discussion on the clinical services next Tuesday when we meet back up again. So if there's an opportunity where each of the respective boards can have this discussion at the early part of next week, perhaps Panhandle Health, you could email the information with respect to the budgets the first part of the week so that boards have an opportunity to at least talk about it. Okay. Commissioner Zimmerman, Domke, Short, does that work for you?
That works.
Yes, it will.
Yes, thank you.
Well, 3 p.m. Meeting adjourned. Thank you.
I guess they moved the other meeting over to the federal building.
I guess so. Ready to go?
Thank you for doing that.